So at the very beginning of the pandemic, back in March of 2020, if we can cast our minds back to that time point, I, as well as everyone else, was working from home, glued to my television, reading the paper, and really recognizing the impact that COVID-19 was having globally. And then started thinking locally about what that might be doing to the women and children that we serve. As an infant preschool psychiatrist, I'm always concerned about what's happening in the lives and worlds of the 0 to 5. One of the other things that I was particularly interested in was not just how the pandemic as a stressor impacted all women, but particularly how the pandemic might impact women of color, and in our city, Black women specifically. So that led to another additional aspect of the study, which is really looking at the impact of the syndemic on Black women's experiences. The study we're going to talk about that was funded through NIH, specifically NIMH, will really talk about the ways in which stress has impacted these women and their children over the past 3 years now. Yeah, so the syndemic is a term that really was used earlier in HIV research, and it really was a combination of two things. And it was saying there had to be an endemic condition and an epidemic condition. So for the purposes of our work, our endemic condition was structural racism, and our epidemic condition was COVID-19 virus. There were many other researchers across both Penn and CHOP's campus that had gathered together prior to the pandemic to begin really working on issues that affected this entire peripartum period through early childhood up to 60 months. And we came up with the idea of sending out an initial survey to all the women who were pregnant and being seen within the Penn Health system. So in trying to figure out the best mechanism, I really was interested in doing a longitudinal study. So I just said, we started gathering our participant sample back in April of 2020 when these women were pregnant. And so the idea I had was really understanding in real time the impact of the COVID-19 pandemic on not only these pregnant people, but also after delivery following their children, which meant doing a longitudinal study. By default, the only mechanism that really sort of fit the ability to follow these families over 4 to 5 years of time was the R1 mechanism. So we really thought it was important to do this multi-method research to be able to capture the experiences of the women who would agree to participate in this study. So that meant these sort of two different things happening simultaneously and across time. So we were able to start following these children through the R01 mechanism when they turned 24 months. We thought it was important to not only understand the mother's experience during the pandemic to date, but also their secondary caregiver. We gave both of those groups significant surveys that tried to really have a better understanding of their concerns, their worries about COVID, but also just, in general. We tried to assess for trauma, for anxiety, for depression. We also tried to, at that time, assess their thought about their child's development at 24 months. So these were sort of big and beefy surveys. Simultaneously, we thought it was really quite important at 24 months to have an understanding of that dyadic relationship. So we had the mothers and their 24-monthers film a set of dyadic interactions where they interacted with 4 different items that we sent in a box to their home. We thought it was really important at 36 months to administer a structured measurement where we were able to really talk with each of these mothers and get a better sense of their mental health using the DSM-5 categories. We're also doing a qualitative measurement, which was really important to specifically understand the syndemic and its impact on Black women. So a sub-cohort of our population will participate in that over the next 3 months, where we ask questions that really are aimed to better understand what it was to be Black, what it was to be pregnant, and what it was to have an infant and very young child over the past 3 years. Then at 48 months, we're going to sort of go back and do these sort of massive surveys that we send both to the mothers, to the fathers and secondary caregivers, and we're going to again have a dyadic interaction with the mothers and the children, most likely virtual since that worked so well the last time. Absolutely. What we're hoping is that we can tell a story that will be able to allow policymakers to really understand in real time how stress impacts dyads, how stress can impact early childhood development. We know that there have been huge risk factors during the COVID-19 pandemic for many families. So the important piece I think we're able to really tell is not just the risk factors, but also the resilience factors. How families were able to, in the midst of all these challenges, still do well. How these babies were able to grow and develop in the way in which we would consider to be optimal, and what kinds of systems, of support systems, they were able to utilize during the past 3 years and over the next 2 to really ensure that their child did well in the midst of the chaos in which we've all been living. So one of the things we're also doing currently is really understanding what happens when heterogeneous groups of people are sort of clumped together. So for instance, in the initial sample, the category that was used, there were sort of 2. One was sort of other, and then that was refined to sort of Asian, Latinx, Black, white, and then multiracial. But we've understood that within each of those categories, there's heterogeneity. And so what we're working on currently is really looking specifically at that group of Asian participants and really disaggregating that data, recognizing that that is an incredibly heterogeneous group and that different groups were impacted differentially during the pandemic, as is reflected in the numbers when they're disaggregated. So we're also hoping that we'll be able to add to the literature, to the way in which we all think about communities of color, and the importance of understanding that while it may be easier to group folks together, it's incredibly important to have this incredibly nuanced perspective of the differences that exist within these larger categories. So we hope in the next several months to have a publication to that effect. So at the end of the day, what we're really hoping is that we can tell an increasingly nuanced story about the impact that families have suffered over the past 3 years, and we hope to be able to delineate that specifically through prenatal to preschool or P2P. Stay tuned.